Hello, my name's Lou. I'm going to be the nurse taking care of you today.
Okay.
I'm going to be doing a head to toe assessment on you to get started here, alright?
Okay.
Alright, I'm just going to come over here and pull the curtain so we can have some privacy.
Okay.
And then before we get started, do you have any cultural beliefs that you would like me to be aware of, including your plan of care?
No.
Okay. What do you like to go by?
Courtney's fine.
Okay, and do you have any specific pronouns that you would like for me to use?
No.
Okay. I'm just going to wash my hands here. Alrighty, and can you tell me your full name, please?
Courtney Greathouse.
And what's your date of birth?
11/28/2000.
Alrighty, and do you know where we are today?
We're WAB.
And do you know why we're here today?
I just had a small tummy ache.
Okay, so the patient is alert and running at times 4. Can you smile for me? Good. And can you raise your eyebrows? So the patient's facial movements are even and symmetric. And can you stand up for me?
Sure.
And can you walk towards me?
Yeah.
And can you walk back? Good. Just have a seat.
Okay.
Patient's gait and balance is appropriate and steady. And then I'm going to have you close your eyes for me.
Okay.
And then just lift your hand to the side that I touch your cheek, okay?
Okay.
Good. And based on my findings, the cranial nerves 1 through 12 are intact.
Okay.
Okay, so now I'm just going to look at your overall skin. Do you have any wounds or lesions that you know of?
No.
Okay. And the skin is pink, warm, and intact. In a hospital setting, we would look at all of the skin, but for today's purposes, I'm just doing what I can see with the eye. And then the hair is appropriate to age and gender. I don't see any thinning or anything like that. Eyes are in the correct position and alignment. I'm going to just gently touch on your face and pull your lower lid down just to look at the conjunctiva, okay? Good. Okay, so the conjunctiva is pink and clear, and then the sclera is also clear and white. Oh, Perla. So I'm gonna look at your eyes with this light and just want you to look straight at me. Okay. And can you follow my pen? Okay. So the pupils were equal and reactive to light, and were accommodated. And pupil size is about 3 millimeters. All right, and then based off this conversation, it sounds like you're able to hear me okay. Do you notice any issues with your hearing?
No.
Okay. So next I'm going to assess the respiratory system.
Okay.
Do you ever have a cough or shortness of breath?
No.
No? Okay. I don't know what I was gonna do. Oh, your breathing is even and non-labored on both sides. And I'm gonna listen now. Okay, I'm gonna take a listen now to the lung sounds. And I just want you to breathe normally for me.
Okay.
Okay, and then I'm gonna listen to your posterior lung sounds. Do you mind to turn for me? I think it'll work. Okay, just taking a big breath here. And again. Alright, then so I'll do clear bilaterally. Alright, and next I'm going to be doing a cardiac assessment.
Okay.
So I'm just going to look at your arms and legs just to make sure that they're appropriate color. And all extremities are pink. I'm going to look at your nail beds, check your capillary refill here. Okay, those are less than 3. Do you mind taking your shoes off? I'm going to check your radial pulses and your pedal pulses.
Okay.
Okay, those are +2 bilaterally. And pedal pulses are +2 bilaterally. I'm also going to check your apical heart rate and count that for a minute, okay?
Okay.
Your apical pulse was 96. I'm also just going to listen to different spots for your heart sounds. Okay, and S1 and S2 heart sounds were heard, and no other abnormal heart sounds present. Okay, so next I'm going to check your musculoskeletal system. So I'm just kind of going to feel on your arms and legs and your joints, okay? Just let me know if you have any pain anywhere that I'm touching. Okay, your knees, your ankles, okay. Okay. Can you squeeze my hands? Okay, so grip strength was even bilaterally, and then I'm going to have you, can you push against my hands? And can you pull my hands? Good. I'm also going to have you do the same thing with your feet, push up against them, and then there you go. I'm going to check your range of motion.
Okay.
Can you put your arms out in front of you and lift them straight up, and then kind of bring them back down around? Good. Can you hold your arms like this and bend your elbows for me? Good. Can you extend your legs? Good. And can you kind of rotate your ankles? Okay. Seems to have appropriate full range of motion throughout. So the next thing I'm going to assess is your gastrointestinal. So first, when was your last bowel movement?
Yesterday.
Yesterday? Was there any abnormalities to the stool?
No.
Okay. I'm going to inspect your abdomen.
Okay.
So I don't see any scars or lesions. It doesn't seem to be distended. And then I'm going to listen to your bowels, okay?
Okay.
Okay, there's normal active bowel sounds in all 4 quadrants. So now I'm going to palpate on your stomach, and I just want you to let me know if there's any pain anywhere, okay?
Okay.
This is light palpitation. Any pain?
No.
Okay. And I'm going to do some deep palpitations.
Okay.
Any pain?
No.
Okay. Alright, no pain throughout the abdomen region. So now I'm going to look at your spine.
Okay.
So if you could stand up for me.
Sure.
Alright, and I'm just checking the curvature of her spine. She seems to have the appropriate curves and convexes in her spine. Let's see.
Mhm.
I might have you turn a little bit so she can look at that. And then I don't see any deformities, bulges, or anything like that. Alright, and then can you turn back around for me?
Sure.
I'm going to have you bend over and touch your toes for me. Okay, and then can you kind of arch back? Good. And can you lean side to side? And then can you twist just from your waist up? Okay. There seems to be no abnormalities with the spine. So you can have a seat there for me. And I'm just going to wash my hands again. And thank you for letting me do a head to toe assessment on you today.
Of course.